Hey everybody, how you doing? We are here today at TriStar Stonecrest Medical Center in Smyrna, and we love working with the group here because they're always doing different health-related events in the community. They're very community-oriented, and they always get new, really cool technology in here, which we're here to showcase today with Dr. Garcia. And but before we get into that, Dr. Garcia, if you don't mind, fill us in on what kind of doctor are you, and your background and everything here at the hospital.
So they usually call us poop doctors, but actually we are doctors of the gastrointestinal tract, so we're called gastroenterologists. And one of the things that we do is that we screen patients for colon cancer through something called a colonoscopy.
Okay, gotcha. And I know we'll get to that in a second, but that's the new technology you have here, right? It's called
Yes.
the GI Genius, is that right?
Yes.
Okay, I got you. We'll get to that here in a second. But I understand the guidelines have changed, right? In screening and the process and the ages. And do you mind filling people in on that for us?
I lived through this personally in the sense that for the past few years, we're seeing younger patients with these pre-malignant lesions that we call polyps, and people in their 30s, 40s with masses in their colon. So it's not only me, everyone is seeing it. So recently, all the guidelines that we follow to determine when to do a colonoscopy, when to start, decreased the age at which you start the screening colonoscopy from 50, which we've been doing for decades, down to 45.
Okay.
That means that someone that has no symptoms, no suspicion of colon cancer, should start their screening colonoscopies at 45.
Okay.
Patients that have family history of polyps or colon cancer, we ask them either to start at the age of 40 or 10 years earlier than their family member was diagnosed.
Gotcha.
Right?
Okay.
So the major change is that now people are going to their physical and they're 45 and the doctor says you need a screen colonoscopy, and they're like, and it's for that reason we're very concerned and being way more aggressive.
Okay. Do we know why yet, as of the reason why it's getting younger and younger? Is there any reason for it?
If anyone knew the answer to that question, so this is a recent development in the sense that trials are ongoing, right? We suspect that it has to be some environmental factor, maybe our water, air, there's more toxins, so our colon has to repair itself more, and that increases the risk of polyps.
Gotcha, okay. All right, well, thank you for filling us in on that. So 45 now, everybody. If you're 45,
please
come on in and get checked. So now leading into that, you have this wonderful new technology that helps detect, what was it? You got like millions of different types? I don't remember the number.
So let me tell you how I see it. You know when you look up at your phone and your phone recognizes your face?
Yes.
So that's our artificial technology, right?
Okay.
So it using shapes and that AI is trained with pictures of yourself, it can recognize your face, right?
Yeah.
So this is basically that applied to while we're doing a screening colonoscopy. I have a monitor that I'm seeing where the camera is going, and we use our eyes to look for these polyps, right? And I am confident that if you have a polyp, I'll find it, but you can't be arrogant. And if there's any tool that will help you find more polyps or find them faster, it's better because less procedure time, less anesthesia, less air, less risk of complications. So the way this artificial technology works, which I call WALL-E because it's the only AI thing that I can remember.
Appropriate, yeah, there you go.
So while I'm looking at the camera, it's constantly scanning the entire monitor for patterns or things that look like polyps. So this AI was trained with 13 million pictures of polyps, so it can really recognize a polyp, right? So while I'm looking at the lining of the colon, I'm looking at one spot at a time, right? So I have to keep looking everywhere, and Wally's looking everywhere else. Sometimes I find one and he finds one on the corner, right? So it helps me find them quicker. Like I said, less anesthesia, less procedure time, and anything that helps you find even the smallest polyps, which in younger patients, their polyps tend to grow on the right side, which they're flat, so they're harder to detect, right? So I think I want my colonoscopy to be done with this because, I trust myself, but if there's an extra layer of defense, it's like two people are looking at your colon.
So going off what you just said, for me, someone that doesn't know anything about this, I always picture, if you say polyp, I'm picturing like some big giant cancerous looking bump, or something, but you just said itty bitty. So they range, or how?
So remember, when you see a picture from a colonoscopy, everything looks big, but everything is very small. So if you were able to see a polyp with the naked eye, it would look like a little pimple,
Yeah.
right?
Okay.
Then if it keeps growing, it looks more abnormal. Then it looks like a little mushroom.
Okay.
And then when it becomes cancer, it looks like this big erratic mass,
Yeah.
right?
Okay. I do want to point out one thing you just said. So you're telling me with the AI and the machine you have right here, and like recognizing on my phone, you guys have transformed that basically to detect cancer.
Correct. I mean, and
That's cool.
I think it's an obvious next step. If we use
Yeah.
these things to use Facebook and
Yeah.
social media, why can't we use them to our advantage? Obviously, this is a way more sophisticated AI, right?
Oh, yes. I get it.
But it's the same concept, but I think that example helps people understand how can something that you don't see, like a camera looking
Yeah.
at something, can help you detect
Yeah.
lesions.
Yeah. I just think it's an incredible use of technology that you have this thing that's just designed to log you into something that you guys have turned around now and have this machine that can detect cancer with that.
Yeah,
And that's
yeah.
incredible.
And cancer, yes, but the pre-cancer, remember when you get one of these polyps, it's like a callus, right? It doesn't have cancer inside of it.
Oh, okay.
Right?
Okay.
Has the potential to. It would take about
Right.
7 to 10 years for it to get there.
Okay.
Because it keeps growing and accumulating more mutations. So we want to find them when they're the smallest possible.
Okay.
Like 1 millimeter, something that you could see with the naked eye, 2
Yeah,
millimeters.
that's tiny.
Right? And then something that small in a colon that when you're in a colonoscopy looks like this giant tunnel. Anything that, and it's moving because people are breathing,
Yeah.
right? So while he's scanning, you don't see anything, but if it detects a change in the pattern of the skin that fits the polyps that it's seen, it will beep
Yep.
and put a little green square around it and lock onto it. It's like, you know, you see these pictures that they're flying a jet and they find the target and it puts a little square and follows it everywhere it goes.
Yeah.
It's like that, right? So you don't lose it.
Yeah. Okay. Gotcha. Now, if I heard correctly, y'all are the only ones around here, what, in the state or in Middle Tennessee that have this technology?
We've been lucky enough to be the first hospital that has this technology. And, you know, when it was presented to me as an option, I said yes, because it made sense. I remember being a fellow thinking it would be great if we could use some sort of artificial technology to help us. And when they told me that this was available, I said, yes, please, where do I sign up? You know, and then we tried it. You know, I wanted to make sure that it was something that was not going to interfere, make it more difficult. It was not going to be more cost for the patient. It has to be a win-win.
Yeah.
And after a month of trying it, I said, you know, the best feedback I can give is when I get my colonoscopy, I want them to have this. Because again, it's a
There you go.
double the screening time.
So wait a sec. So before you even had it, you were testing it out. So like you're the man with this.
Well, I wouldn't say that. I would say just the
He's modest,
the first one here.
No, that's amazing. Okay, well, so the most knowledgeable one around right here at TriStar, right here in Rutherford County, TriStar Stonecrest. So that's awesome. So, but we want to thank you for your time. We know you have surgeries and everything to get to. So, you know, to our audience out there, is there anything you want to close out with them or tell them to come on in here and get screened or anything you'd like to
Yeah,
say?
I mean, the most important thing is remember, even if you don't have any symptoms or any risk factors, it is important to do colorectal cancer screening starting at the age of 45. If mom, dad, or siblings, anyone in the family has had history of polyps or colon cancer, you might need it sooner. Ask your doctor, come to the clinic, let's talk, let's figure it out. And this should be something that helps people make a decision, know that on top of just the doctor, a human, there's also this advanced technology that is helping us detect. So they will get more for their time.
There you go. All right. Well, thank you again for your time. We know it's very valuable. We appreciate you taking time to meet with us. And if y'all have any questions or comments out there that are watching this, put them in the comments below and we'll try and answer those as best we can and we'll get back to you on those. And also thank you to everybody here at TriStar Stonecrest, the ones behind the camera you can't see. Thank you for letting us come in and do this video. So there you go. Again, one more time, appreciate your time. And if you're 45 or older, come on in and get screened. So There you go. Thank you for watching, everybody. We appreciate it. And you all have a great day.
Thank you.